Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Of course I'm living it up, Nita.
Well, you cut to the chase there, didn't you? Well, I'm living it up too, and we want our listeners to live it up. So maybe I'll just talk about that for a minute and how that can be accomplished. If you're having any kind of musculoskeletal pain, which means joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, anything like that, basically orthopedic pain, then you have come to the right place on your dial or your computer, depending on how you're listening to us today. If you're in any kind of pain, you want to call the program, talk directly to Dr. Darrow about your pain, and see if that can be figured out and get you on a track to be pain-free. That number is 866-870-5752, right here in the studio, 866-870-5752. And also you can check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. And if you're new to this program, we are here Saturdays at 10 a.m. and again at 1 p.m. There's other things going on in the office. We'll get to those later. But the main thing we want to talk about today is your orthopedic pain. And every week, Dr. Darrow, it never fails, we get slammed with calls at the end of the program and we run out of time. So I'm asking you, dear listener, please call early in the program like now. 866-870-5752. And here's the best part. When you phone the program today, you get Dr. Darrow's latest book for free. It is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has over 250 scientific studies, and the foreword is written by Suzanne Summers. And you appear in her latest book also, I believe.
That's right. She's a great writer, and she's been the mainstay in the advancement of what is called alternative medicine, which really isn't alternative. It's medicine that's been around since the beginning of time. It's natural medicine. So, Suzanne Summers, I love you and thank you so much for doing the great work that you do.
Absolutely. So again, if you're just joining us, you have muscle pain, joint pain, knee pain, arthritis pain, back pain, and neck pain. Back pain is one of the most popular things that people go to the doctor for.
Popular.
Like how I said that? So
you're making me laugh, but I got one for you.
Okay, go.
Where do horses go when they're sick?
Where do horses go when they're sick?
The hospital.
Oh my gosh, that's a good one. That's a good one.
What did the horse say when it fell?
Take me to the hospital.
Well, that too. I've fallen and I can't giddy up.
Oh, where are you getting these? These are adorable from your patients.
Yeah, my patients are very sweet, and they're listening now, so thank you guys. But then the best one of all, you ready to laugh?
Ready, always ready to laugh.
How do you make a small fortune at horse racing?
You make a small fortune at horse racing by
starting with a large fortune.
Oh, that's great. That's a good one.
Come on, get with it.
Too early in the morning for me, but not too early for you to give us a call. Yeah, well, I don't drink coffee. That's a problem, probably. 866-870-5752. Right here in the studio is our number. I have lines open for you right now, and I bet you have a question standing by.
I do. I've got tons of them. So by going to the website, which is www.lastemcells.com, there is a spot on every single page where you can email me. And I get emails day and night, and I answer all of them. And as my listeners know, or at least my patients who have been in who are listening, I give out my cell number and my email address as soon as you walk in the door. So if you have any issues, you can call me. And I get texts all day long. I answer emails all day long in between patients. And I love communicating with you guys. And that's one of the reasons we have this radio show, is so you can talk to me. So give us a call at the station now. It's 800. Oh, I'm sorry, that's my office number. Well, I'll give that out too.
Yeah, give that out too.
My office number, if you're picking up the show at an odd time, is 800-300-9300. I'll repeat that. The office is 800-300-9300. And if you want to talk to me live right now, give me a call. Give Nita a call at 866-870-5752. 866-870-5752. And the question that just popped up here comes from someone whose name I won't mention. It's a female. And she says, how do you treat TMJ? That means temporomandibular joint. And that's the joint that often wears out, just like the knees wear out, like shoulders wear out, like toes wear out, backs and necks. It's no different. And I do treat the whole body. Most guys who do this work don't do the whole body. They'll do knees, shoulders, maybe hips. But I do everything. Nita, you're kind of creaky over there.
Oh, my pen dropped. Sorry.
We'll have to get...
You thought that was my bones cracking, didn't you?
Yeah. So do you treat TMJ with both jaws, both sides of the jaw, having osteoarthritis and bone remodeling? Yep, all the time. Had a CBCT, that's a type of x-ray, panoramic x-ray that's done of the joint, in 2016. Now I think it's worse. Daily pain after eating or talking a lot. Oh, that's so funny. You know that men talk about 1,000 words a day, and guess how many women talk?
2,000.
3,000? 10 times that.
10,000?
10 times that.
Wow.
10,000, yeah. That's why us men have to learn how to be good listeners, which we are. And then she says, sometimes I get headaches. All of that stuff hopefully can be helped by doing regenerative medicine. That's an injection in the both sides of the jaw. I use what's called a 30-gauge needle. It's like an acupuncture needle. It's about the smallest needle you can push a solution through. And we use platelets and or stem cells to heal that up. It has worked in amazing, amazing cases where people are ready for surgery. And you don't want to get surgery on that joint. The ones I've seen didn't come out too well. So there's a lot to offer with regenerative medicine of platelets and stem cells on the TM joint, just like there is for neck pain, back pain, shoulders, biceps, elbows, wrists, fingers, and all the way down to the low back and the hips and the greater trochanter and the knees and the ankles again, because there's two of them. And
good to know.
Toes. Yeah. And the most common sprain of a ligament is in the ankle, the anterior talofibular ligament. I just did one of those yesterday with a young woman who's a lawyer for Netflix, and she's a wonderful woman. I treated her knees before she had complete healing, and then yesterday was the first time we did her anterior talofibular ligament, and I'm hoping she's doing well. And those usually heal up very, very quickly, oftentimes with just one treatment. So, yeah, this stuff works really well, as everybody knows who listens to me. I've injected most parts of my body from sports injuries. And for those of you who are watching this show, you can see I've got a golf shirt and a golf hat on. And after the show, I'm going to go out and play golf. And I've had some terrible injuries to both my shoulders and knees. What else have I injected? My elbows and my right wrist and my neck and my back. Okay. So most of the stuff I can do myself. Nita, you're piping in. That means we have a caller to go to.
Yeah, let's go to Rose.
Rose, you say, can you help with RA? You have so much pain. So first of all, Rose, let me tell you about RA. RA, for everyone who doesn't know what it is rheumatoid arthritis. And I inject people with rheumatoid arthritis all the time. I just had a patient in a couple of days ago that had it, and we injected that person. So RA is an autoimmune disorder in which the cells of the body are attacking itself. So the first thing to try, Rose, is to get on what we call an alkaline diet. That means you're eating fruits and vegetables, doing a lot of blending. Get yourself a magic bullet or a Vitamix and throw all your vegetables in there and fruits in there, and stay low on the proteins. So what that means is proteins have amino acids in them, and acids cause inflammation of the body. So you want to get on an alkaline diet, not an acid diet. That works for most people, so you should try that. I can inject the areas on your body that are inflamed, but not when they're all swollen and red, because they're already very inflamed, and we don't want to add more inflammation to it. But a lot of times people come in with rheumatoid arthritis or RA when the joints are kind of quiet, and then we can inject them at that point. So what part of the body is bothering you, Rose?
That's my knee. Yeah, both knees right now, but the left is really hurting me a lot.
Okay. Well, yeah, that's something that we can usually help with. And although you have rheumatoid arthritis, you may also have osteoarthritis in your knees. What age are you?
I'm 60. I forgot 67. I'm 67.
Good. I want you to forget your age because it doesn't mean anything anymore.
Thank you so much. It's so fun to listen to you, too. I really
Thank you.
Thank you. But low protein, alkaline diet, fruits, vegetables. I don't weigh that much at all. I'm like 110, and I'm like
that's good.
Perfect. I don't want
your perfect weight.
Well, I would like
you try that diet for a week, and you'll probably be pretty surprised at the diminution of the inflammation in your knees and all over your body. I've done the diet many times on and off through my life, and because I do a lot of sports, I get inflamed a lot, and it really helps quell down all the pain in the body. It's something everybody can try, and you can look up alkaline diet on Google, and it'll give you some tips. But it's pretty easy. You just get a blender and throw in, all your fruits and vegetables. And
okay, Doctor.
Yeah, it's
Dr.
real simple.
I wanted to ask you. I typically will have a little bit of lemon water in the morning.
That helps also. That's alkaline.
Been habit for a long, long time, and I drink it throughout the day. So, but this is what's happening. My RA specialist said to me, okay, well, and this is, I've never had a cortisone shot, but he did that to my right knee because it was swollen. Yeah. I said, okay, so you're just going to take the fluid out, and then you're going, and that's it. And that's what I thought. But he said, no, I gave you a cortisone shot. And I said, I don't want one for my left knee. I just want to take the fluid out. And he says, well, it's not going to help you if you don't get the cortisone. So I just want to insist that he just take the fluid out. Would that be okay? And then, of course, don't give me my cortisone shot. I just want to take, like, some things like fish oil, something to help me with that. Would that be a help?
Yeah, I mean, there's studies that large dose fish oil can quell the inflammation in rheumatoid arthritis. There's a lot of supplements that help get rid of the inflammation of the body. The thing that I found personally that works the best is alkaline diet.
Okay.
So draining the fluid out may be helpful for you, but putting cortisone in is counterproductive. It'll get rid of the inflammation because it's a strong anti-inflammatory. It's a steroid, and what it does, though, is it dissolves away the cartilage. So you win the war, you win the battle, but you lose the war. down the road, it's going to make it worse. So I wouldn't be doing that if I were you. I would try the alkaline diet and then try it for a week. Get back to me, and you can go to the website at www.lastemcells.com. That's lastemcells.com. Every page has a spot to email me. Email me in a week, and let me know if it worked.
Thank you. I'll do that. I appreciate you. Thank you so much.
It works on just about everybody I have do that.
Oh, that's great. I should have called you a long time ago about this.
The other part of it is I would use regenerative medicine with platelets and stem cells to rebuild those knees.
Okay. All right. I'd like to do that also, Lord willing. I'm praying about my finances that will allow for that. So I thank you for your program, both of you. God bless you.
All right. God bless you too, Rose. Thank you so much. And if anybody wants to call the office to get more information, the phone number there is 800-300-9300. We have people on the phones all the time. If they're busy, just leave your number. We'll get right back to you.
Okay, that sounds great. And if you are hesitating to call, don't hesitate. You get your free book, and you phone 866-870-5752 right here in the studio and speak directly with Dr. Darrow, who has all the answers.
I'm not so sure about all the answers,
and the jokes.
But I do my best. You know what? I always tell people, my patients have lots and lots of questions, and I tell them to give me all their questions, and then I give them my email address and my cell phone to ask me more later. And I say I don't know all the answers, but I can usually find the answers if I don't know them off the top of my head. And I learned a long time ago not to say I don't know, because as soon as I say I don't know, the answer usually pops in.
Interesting. So you really do know. You just can't access it in a nanosecond. It takes a second or two.
I just don't know that I know.
And you're only 16. You'll be 17 soon. So you'll learn more. It's great. So,
I'm going to be 16 this summer, July 5th. Send me presents.
I know. My birthday's 2 days after yours. That's why we get along so well. We're both little moon
children. I know.
children.
I'm 2 days older than you.
And a few years. Just saying. So our number is 866-870-5752. Check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. Very exciting stuff.
I bet you'd like me to take another question before we go to the break.
I prefer that over another joke.
You're just mad because you didn't know the answers to the jokes.
That's right. Absolutely. I mean, 3 in a row I missed. Come on. That's, embarrassing.
Really? I wanted to mention that we also do hair regeneration in the office using platelets and stem cells. And we do the vampire facelift. You'll never forget that term. It's a non-surgical facelift where we put platelets and stem cells and/or into the face to regrow the collagen and make you look young again. It works very, very well. So I'm going to go to a quick question here. It says shoulder ligaments, and the person says, what do these injections do, meaning regenerative medicine of platelets and stem cells, when the shoulder has torn ligaments? So I think that's a misnomer here about ligaments. Usually there are ligaments in the shoulder, but usually what people are referring to are the tendons. Tendons and ligaments are similar in nature in that they're both made of collagen, but ligaments attach bones to bones and tendons attach muscles to bones. So usually when we're talking about the shoulder, we're talking about the rotator cuff tendons, which as we age tear pretty simply. Most athletes that I see have torn supraspinatus tendons in their shoulders. It's the most common tendon tear, and we can usually fix those up. So I use an ultrasound to look inside the shoulder. I see where the tear is. When I do a shoulder, I do a very comprehensive treatment, and I know this sounds terrible, But I usually inject about 30 or 40 places on the shoulder because it's so complex. We have all those tendons. We have the joint. Actually, there's two joints, the acromioclavicular joint and the glenohumeral joint. And then we have the subdeltoid bursa. And there's a lot of territory to cover. But usually when people ask how many injections they had, and I tell them how many, they say, I can't believe it. It only felt like 2 or 3. So there's a mechanism in the body that shuts off the pain of the injection. And yes, there is a little pain with injections. I'm not going to say it's not. It's very much like acupuncture. We use small needles. But there are a lot of injections in the shoulder. Other parts of the body get one injection. Knees typically get one. Sometimes if there's meniscal tears or if the patella is loose, we may do a lot of injections, or the MCL is inflamed or torn, and maybe more. A hip generally gets 1 injection. Necks usually get about maybe 4 to 6. It just depends. Toes or fingers usually get 1 or 2, depending on where the joint is. So it's different. There's no cookbook for doing regenerative medicine. And unfortunately, most of the guys that do it don't know this. Typically when orthopedic surgeons, and I love orthopedic surgeons, this is not a negative statement, but they're generally not schooled in regenerative medicine. They're schooled in surgery. When I get people who come in who have had PRP or stem cells from an orthopedic surgeon, they generally say it didn't work. And I say, how many shots were done in that shoulder? And they go, well, 1. And there's no way to heal a shoulder with 1 poke. I am sorry. It's too complex. And I say, did they use an ultrasound? No. You need an ultrasound on a shoulder, a knee, or a hip. Other places you can do it by touch, but those joints are teeny. And studies show if you do it blind, that means without an ultrasound, you are going to miss the joint at least a third of the time. And that solution then goes where it doesn't belong. Nita, Were you breathing?
No, I stopped breathing. I didn't want to disturb you. So we have a phone number here. We're halfway through the program, and I don't want you to miss out. Lines are open for you at 866-870-5752. That's 866-870-5752 right here in the studio. And you get to speak directly with Dr. Darrow. And check out the website at www.lastemcells.com. We didn't give the office number lately. 800-300-9300 is the office. You can call there directly for more detailed and personalized information. And you can call that number 24/7. 800-300-9300.
Thank you, Anita.
You're welcome.
So I'm going to take a knee question here.
All righty.
This gentleman says he has a bad knee from a patellar dislocation injury, thinking stem cell or PRP therapy would fix it. Yeah, it does in most cases. So all of us have our patella moving out of the track in the trochlear groove, which is in the femur. The patella is the round bone in front of the knee. So as we bend our knee, it slides up and down and deeper into the femur. So oftentimes people wake up and their knee is swollen. And they go, I didn't do anything, doc. Why is my knee swollen? Usually that patella will loosen up while we're asleep, and sometimes it'll go off to the side a bit. That's not a dislocation. That's what we call a subluxation. But very often soccer players, when they get hit on the patella, it will actually dislocate all the way over to the side, the outside of their knee. And that's a very, very painful injury. And what they often will do is take their fist and bang it back into place. And it's a very painful thing to happen. When that happens, when the patella dislocates, the knee will usually bleed inside. Stick with us, folks. We'll get back to that question and give you more information soon.
And you're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.